Well, news broke this week about a mutation in the coronavirus in England. A new strain of COVID-19 could be up to 70% more contagious.
Scientists don't think this new strain is more severe. It just may be easier to get. Here to talk about this and other COVID news is Dr. Zorba Paster. Zorba, welcome on this Christmas Eve.
Good to see you guys.
How concerning is the news of this mutation?
Well, the concern is basically how fast the virus will spread in Europe and when the virus will spread in America. Undoubtedly, if it's in Europe, it's probably in America too. From the point of view of the vaccine, it makes no difference because the vaccines that are developed actually are working on the spike protein. That's the little spiky thing that we see on the outside of the virus, and the spike is exactly the same. But it is not unusual for RNA viruses to mutate. They do it all the time. Same thing for the influenza viruses. The influenza virus back in 1918 also mutated the same way. So it's not that the virus is worse, it's that the virus may be easier to spread, which means mask up, socially distance, wash your hands, do your job. It's still a matter of time because until we all get immunized, basically the virus is still going to cause havoc to our society.
Well, and you touched on this, but just to emphasize it for everyone who's wondering, the current vaccines will work on this new strain then.
I stand behind it. And frankly, when they designed the vaccine, they designed it specifically with this in mind. They know that RNA viruses mutate. It doesn't go to the core of the vaccine. It basically is on the outside coat, piercing the armor of the vaccine so that our antibodies can actually get in and destroy the vaccine. So it turns out the vaccine will work just as well. Remember, the vaccine is 95% effective. That's astounding in terms of its effectiveness in keeping away COVID and keeping away hospitalization. And it turns out it's about 10 days to 2 weeks after you get vaccinated that you're really almost in that 95% range with that booster keeping the immunity up.
I read 70 to 80% of the population needs to be vaccinated in order to get this herd immunity. We reached 1 million vaccines in a week. Is that enough?
No, it's not enough, not nearly enough. And it's really a matter of basically how do you deploy the vaccine? You may produce the vaccine, but how do you actually deploy the vaccine? First of all, we're just beginning to roll it out. If you look at the warfare commander, I can't remember what the general's name, he's taking good responsibility trying to roll it out, but those are really the issues. You've got to manufacture the vaccine, get it into the arms, and make sure people take it. So 1 million out of 325 million, I don't think it's nearly enough. But in fact, we are moving forward, and it's going to be quicker and quicker and quicker over time. Right now, it's only the workers and the healthcare systems. I don't know what the next step will be. It all depends on the CDC guidelines and, frankly, what our state will decide to do. I'm sure we're going to follow the guidelines from the CDC on who the next set of people to be vaccinated are.
And we're working on some stories about this at-home testing kit, the saliva testing kit at 5 and 6. So how effective is that new testing kit from the state?
From what I've heard, it's pretty good. I mean, there still is a false negative rate. I'm not sure if that false negative rate is 20 or 30%, meaning the test will say negative and you really have COVID. But anything that will allow you to determine if you do have COVID, in other words, the positive rate is really good. If it says you have COVID, there's a 95% chance you do. That means you have to self-quarantine for 14 days and do your job. And I just want to tell you a quick story. I had a 28-year-old guy in my office virtually to try to get back to work. He had isolated for 14 days. And I said, you have COVID. Where did you get it from? He said, well, I was helping somebody move. I assumed it was a 28-year-old he helped move. And the answer was no, it was his uncle. His uncle was 60 years of age. His uncle didn't believe in masks. And in fact, his uncle at that time was in the hospital on oxygen. So it's important to mask up. And unfortunately, not everyone believes in science.
All right. Well, hopefully the new year will bring better news all around. Zorba, happy holidays to you and your family.
Happy holidays to you, too.
We'll be right back with a final check of your forecast.